kind of
Food always works. Somebody
Food.
said
Oh,
that.
someone made a comment. Food always works. That's right. With your candy. So bribing them with something.
I just explained that in the real world, when you talk with patients, sometimes it's going to be awkward. And you got to learn how to have those awkward silences and that you can outlast them because, you have to eat it more often.
Right. So awkward silences, that's a good point to bring up because when you're up there in front of the group of students, even like 10 seconds feels like forever. You're just all these faces staring at you. So sometimes it does get to that point of waiting the 20-30 seconds till it becomes awkward for them and just kind of wait, I'm ready to move on, just need an answer. So, and eventually someone does get around to answering. Do you think though, when you pose that question or that case, sometimes they need that 30 seconds to look back at their notes. So it feels like a long time to you and it might feel like no one's answering me, but it might be that they're trying to click back and trying to put together a couple thoughts or what did she say about that and what slide is it? And it takes them a little time to sometimes take a minute to research the topic or figure out what they'd want to say. They can't just blurt it out because they don't already have everything memorized. So think about it that way as well. That, definitely give them a chance. Don't be running to their rescue and providing the answers. Make them try to look a little bit. You could always give tips, like if they don't seem to really be getting it, say, all right, remember that diagram we talked about? Maybe that would be a good place to start. And so it kind of gears them towards the right direction for finding the right answer.
Some people also give like extra credit for participation. That always works too.
Yeah, extra credit always works for whatever you want them to do.
Right. And just even letting them know it's going to be a very interactive class, when class just starts, so they kind of understand there is some, requirement for them to be involved as well. Mm-hmm. So that when it does get to that point, okay, fine, you guys, you also need to ask me questions, so here it is.
Right, yeah, you can definitely give them a heads up that there's questions and cases that they're going to be expected to keep up with and answer. So hopefully maybe they'll pay attention a little bit more than they normally would have if they knew that it was just like relaxing. Don't need to answer anything.
One of the things with students, I think, is I think when there is, we've all been students, but when there is something attached to their grade, then they will more than likely participate. And we're going to talk about this more kind of next month too, but some of the active learning strategies that we've been doing and the TBL, team-based learning strategies. But I think when there is an accountability, and it's human nature, I think when there's more of an accountability and there is some kind of could be a consequence if you're not participating, then I think people are more likely to do that. Now, it's hard. But let's say you're lecturing, it's not a student lecture. Let's say you're giving a lecture to a group of pharmacists, how could you encourage them in your presentation to participate? So how could that kind of, we've talked about some things about, the response systems and things like that, but what would be some other strategies to kind of get them engaged in your lecture?
Call people out.
Okay, you could.
I like it.
Call people out. So yeah, you said the Socratic method. Yeah, so you could.
Open discussion. You can like to debate with each other. Like be like, this is my opinion, and then someone questions like, well, this is what I do, but then you might lose control of your lecture at the same time too if you're in, depending on the group of people there.
Mm-hmm. How else? And any other ways that you might be able to engage your audience a little bit more? Has anybody been to a lecture where they did kind of the think, pair, share kind of thing, where you got up into like a pair, somebody that was sitting beside you or something like that, and you had them discuss it for a few minutes, a question or a topic or whatever, and then you kind of come back together and you share that with the group? That can be effective. I've seen that done, and I think that can be effective. So, what else? How do you encourage participation? Bribes, candy, things like that. So,
I had one professor in one of my history classes in undergrad who, if you answered one of his questions in class correctly, you would earn 5 bonus points on his next quiz, like you said. So something attached to your grade. Now, it was unlimited as well. So if you answered all the questions, you could make 180 on his quiz. I mean, a lot of students responded well to that, obviously.
So I think some of it, and I think Dr. Western will probably talk about this here in a few minutes too, but I think you're bringing up a good point too, Ian, is that you kind of have to know your audience. You think about it, even for kinds of getting participation, know your audience. So if it's more to an adult learner, what's important to them? What would be important to them? Well, if it's to clinicians, it's probably going to be something that they've seen in practice, or something that's relevant to them in practice. And so I would bet that you're going to engage them more if you kind of bring up some of those types of scenarios. With students, again, maybe it is somewhat tied to their grade, but what's going to be kind of their incentive to do that? Is there more of an incentive? It amazes me too that before an exam or something like that, where you'll see more students in the classroom, right? If you're given a review or something like that, is there kind of more of an incentive to be there to do that? But anyway, I think, again, if you can kind of know your audience and know what's important to them, and then I think that can help you too to figure out how to best get them engaged in your lectures.
And you might change year to year. Like as the class changes in more of an academic setting, you find that each class of students has their own kind of personality. So some are a lot easier to get to be interactive and provide answers to cases and questions. Some you kind of know going in like, oh, this is going to be pulling teeth to get them to answer my questions, or like who the people are that you pose it to the group, and if no one answers, that's the person that I'm asking, because I know that they study ahead of time, or they're prepared, or they're always willing to just throw out an answer no matter what. So you kind of learn the vibe of each class, and from year to year it's going to change if it's something that's easy and you're going to put maybe a few more cases in than normal because they're really into the discussion, versus if you do need to do more of a bribery tactic with bonus points or candy or whatever it happens to be. So sometimes you have to change up the method depending on the group you're with or how each class changes.
I think it's also very important how you respond to answers. I know there's some people also too, when they get a wrong answer, they kind of penalize the student or kind of embarrass them in class, knowingly or unknowingly, and that will deter, more people from speaking out. So even if someone gives you a question and answer that's completely left field, just be okay, fine, I see where you're coming from, that's a good thought, but not exactly what I'm looking for, somebody else. There's a better way to phrase it than absolutely not.
Yeah.
What you're thinking.
Very good point. Yeah.
So how you respond to answers also will, determine how to answer the question.
Good. Definitely.
This is also going to that. It's also important not to just always point to the student who raises their hand first. If it's the same student every time, make sure that you're getting people in the class involved. You always have sometimes have one student in class who knows the answer every single time. You don't want it to always be them that's answering the question.
They go right in the face.
Exactly. You also have to be cognizant of distant sites. So depending on where you are, you may or may not have a satellite campus that you have to kind of keep in the mix. So when you're not on that site, it can be easy to kind of forget that they're there. So sometimes it's good to, in your practice, just even prompt yourself, all right, the first question, I'm going to just open it up. I'm probably going to hear from the campus I'm at because they tend to interact a little bit more when you're right there in front of them. But question 2, I'm going to actually say someone from this campus. So here, Ashburn being our satellite. All right, someone from Ashburn, please provide me an answer and try to actually stimulate something and ask from them. You're not forgetting about them. So a few things we haven't kind of talked about yet is more the actual mechanics of the slides themselves or the characteristics. So a few things to keep in mind as you are putting them together is think about your coloring. You always want to make sure that your background color of your slides versus the text of your slides are clearly different in color. So if it's a dark background, make sure it's like a very light or white text versus more of a lighter white background and dark color on that so that it clearly comes through. Also thinking just about the font that you choose and the size of it. So you want to try to avoid the calligraphy type pretty text, going with more of the standard. What's wrong?
Just trying to get you.
Oh, okay. I'm like, why is there noises and things like that? It's
Look
very
at that.
distracting. But thinking about the type of text that you select and the size of it, so making sure that you're very cognizant of that. That's why it's really important with practicing as well. If you actually get into the room or the technology that you're using, you can kind of see how your slide set in a small version translates up on the larger screen. So how does the color look? Is this a darker room versus a lighter room? Do I need to change anything up? If I stand in the back of the room, can I still read my slides easily, or did I get any of my text potentially too small? How's my spacing? Sometimes you don't realize like something's off the slide set that you didn't realize because it kind of changes or distorts the size of your slides. So things like that, you can kind of try to prevent any issues from coming up if you do that practice session and think about that as well. Also like pictures and graphics, making sure that you pick high quality pictures. So if it's blurry and going to be difficult for them to interpret, it's probably better just to leave it off versus trying to say, well, if you could see this, this is what it's trying to show. Search for one that you can have a very clear depiction of what you want to show, or just avoid including those types of things because they usually more detract from the lecture versus help the teaching point along. Any other kind of mechanics or kind of rules of thumb you guys were discovering as you create your slide set?
I think the flow of the lecture also matters a lot. Like, don't just start jumping from one topic to the other when they come back to
The
that
flow.
topic.
Okay.
You have to make sure that you talk about something, you completely wrap it up, and then move on to the next thing. Or if you want to connect them, you have a connector slide or something, so people understand the transition. Because if you have a very disjointed presentation, you can have all the information, but how you present it is maybe hard to receive as a student. I know I had that issue a few times. So just making sure that as you're practicing, it makes sense to you to at the flow of your lecture.
Yeah, the flow is a big piece.
No, it's a very good point. In fact, I liked how you said you can have a connector between slides. You can also, sometimes those connections are the hardest. The thing, they're not hard, but we take them for granted, I guess. And so I think you almost need to make sure that you're doing that, because that makes for a really good presentation when you can connect your one slide to the next slide, or your one topic to the next topic. Is important. And sometimes we do that by, if you're kind of transitioning from one topic to the next topic, is kind of pause and say, are there any questions on this before we move on to this next topic kind of thing as well. So.
Yeah. The flow and transitions too is why it's important not just to practice out loud to yourself, but doing it with someone else. So a content expert is always a good person to have so you can kind of comment on that, but even just any general mentor who can sit and listen to the presentation, who can tell you, I completely lost you between slides 8 and 10. I didn't know where you were going with that, or it seemed to not really flow well. There was this weird jump between topics. So that's why we want multiple people to listen to your lectures ahead of time, not just for content, but also to get that flow and, be able to practice the verbal presentation of it as well. So those things come up as you're starting to kind of talk through your lecture. You might catch some things, but an outside source who's not as tied into why you organized it the way that you did can kind of get that outside perspective to help with that.
How much text do you all think should go on a slide?
I think it's always 7 lines, but I realize that doesn't always apply after things work out.
It depends on it really depends on how skilled you are at presenting it. I think sometimes some professors can get away with more, or sometimes less is more for others.
It really depends how the presenter and convey the important points.
Sorry, keep going. I just saw boxes popping up. I wasn't sure if it was a comment or something like that. Yeah, I liked how you said that in terms of, there are rules of thumbs that are out there, and 7 does kind of seem to stand out as a general, like no more than this many tabs over or whatever. But I think it does depend on the lecture as well, and depending on the content on that side as well. Some are able to get away with it, or sometimes it just fits better. There's a lot of text on the slide, but it summarizes this whole point versus trying to break it up and you're trying to look at these slides and how does all this fit together versus some it's less is more kind of varies, and something you'll find you'll tweak as well if you do the same lecture over and over again. You do it one year and then you said, oh, I like this. I really didn't think this went well. You get feedback from people who are attending your lecture, maybe from students, and then you continue to modify things based on what you think is going to work better.
My surgical prophylaxis lecture, like when I talk about surgeries, it's really hard for me to get over the fact of like putting multiple things with multiple columns, because I'm used to like, I was always taught like 7 lines and short, not complete sentences. So I have like different, like I talk about the pathogens, the risk factors, the common regimen antimicrobials used, and then like some other considerations, like all on one slide. But it didn't make sense to make like 4 separate slides. So that was like really hard for me to do that. But I think it works if I just talk about like the high points. So.
But I think, go ahead.
I'm saying creating tables can also help as well with, the amount
Yeah.
of text you have on there. So for your example, you can just have it, one particular surgery, just have it in table form. Here's what you would do, here's what you do for the different topics.
Yeah, and that's what, like, at the end, I summarize it in my table. So what are they going to look at? Most likely the table, but it's just
Right.
Yeah, I always like pictures over words whenever possible too. So if you're explaining something that's, a process or something like that, you can have a slide that's pictures and you do your talking on that slide, and then maybe have a separate slide that says, okay, you don't have to go read through it, but here it is in text for anybody who wants to, review the steps or learn it that way, I guess.
Yep, definitely. Provide it in multiple formats. Usually processes and like mechanisms of anything. Pictures usually help. Words can take you so far, but then showing how it all comes together. Definitely.
And I think it's easier if you don't have as much on your slides. It's easier to sound like you know more about what you're talking about. It really is.
Sure.
Because you can expand on things, and it helps you not read your slides. Because it makes you know your material better. Because you're not going to sit up and say blah 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 because you didn't write everything down on your slide. It's like these points, and you have to expand on them. So I think
so Erin brought up a good point about sometimes when you have less, it makes you sound a little bit more knowledgeable because you have a lot of things you want to expand on, and then there's your talking points, but you're expanding on each. So that's definitely something to keep in mind. So then what if I pose the question to you, Erin, though, so you get feedback from your students, and they're like, I can't keep up. I need to write down every detail you said. And you said a lot. There were just a few points on your slide. So how are you going to deal with that?
then that's when you grow. And
So you tell the students just to type faster?
No, that's when you grow. Like not the students, but that's when you do learn to put more in.
Okay. So that's going to be some feedback. You're going to put a few more points on next year.
Like I'm not saying that my lecture is only like little words here and there, but I think the by not overkilling, you know what I mean?
I like personally when I sit through presentations and there's like paragraphs on the slides, I'm like, this person does not know what they're talking about. Or they know what they're talking about, but they're not prepared possibly because it's, and then when they just start reading, I'm like, oh my gosh, I can do this myself. Like, yeah, and I think you can tell. I totally agree with you. And I feel like people, it may look like they're more prepared too. And they probably are, but I always, from the student's perspective, I noticed that, and I kind of like that, but like right away when I saw a bunch of stuff on the slide.
But if you're well prepared, you'll hit every point on your slide and emphasize it. And so you should be able to keep up with it. But no, I was one of those kids that couldn't keep up, so I do.
Well, we tape the lectures, so,
Listen to the lecture
but-
again.
Well, I'm actually curious. Is it a best practice that you have to have the answers to the assessments available on the slides, or is it perfectly acceptable that the answers to the assessments were verbally delivered only? They are not on the slides themselves.
Yeah, I would say it's definitely perfectly acceptable not to have the answer showing. So you have the question posed up there. It could be part of their slide set so they can follow along with the case that you're reading. But then you stimulate the discussion, you get all the feedback, and then you tell them, here's what the best choice would it be, and kind of go through all the main teaching points, but you don't have to re-put up there what the correct answer would be. You could just do that verbally. So they need to be in class to get it, or if they have the recording, they'd have to, go back and listen and record the answer, but it's not provided right there for them.
And that's reasonable for the tests as well, not just cases presented in class, but material that you're testing on.
Right, so you're saying like an exam question per se?
Yeah, my concern is the student that comes back and says, well, the answer to that exam question wasn't on any of your slides.
Oh, I got you. So, okay, that can be a tricky area, but still, like, as long as it's said in your lecture, you're getting that content across. You still can test on something that you didn't expressly write out on the slides for them, that you still said verbally. It definitely covers you more easily if you have a recording where you can go back to say, see, listen to 3 minutes and 38 seconds. Here's where I made that statement, even though it's not on your slides. But no, you can test on things that were discussion. I do think that as faculty get more experience, they tend to make sure big points are on their slides just to cover for everything, but you don't have to do that. They just don't want to run into issues later, or like a challenge, someone coming and really fighting for a certain answer or point back. But,
okay, that was kind of my question is there kind of a best practice with regards to that?
I think, and Mark can definitely comment on this from his experience, I feel that's like from experience and kind of presenter to presenter preference, like what they're most comfortable doing. It's definitely not something you have to do. I just feel like people who've been burned in the past just start to put it on there just to avoid any type of issues later. But Mark, I'll let him comment on that as well.
No, I agree. I don't think, I'm not sure that there's any one right way or best practice per se. I mean, honestly, but I think either way is fine. I think if you say it in class, then it's fair game that you could be tested on that. And I think the students know that usually and realize that, even though it's not on your slides. And I think we need to make sure that everyone, we realize too, that slides are just, are not the end all be all. Slides are a tool in terms of teaching, but I think honestly, we can rely too much on our PowerPoint slides. And I think, it becomes more of the slides versus the material. You know what I mean? And so sometimes I think it's up to you. I think it's up to you what you put on the slides. I think what Amber is saying to those, realistically, I think there's a balance with students that you probably need to have enough on your slides so that they don't feel like they are incessantly having to just type as fast as they can, because I think it'll become distracting for you as a lecturer too, because they'll be constantly stopping you and saying, what did you say? What did you say? And so I think there is a balance with that. But again, just don't think of the slides as the end all be all either. Anyway, there's another point I was going to make about, I was trying to think about the, if you have something, I think as Amber said too, the important things, if you really want to stress something, then I try to be transparent about things too. I don't want to hide things from the students, because if it's something I really want them to learn, then I'll put it on there. Hey, this is very important. And you stress it a couple times, but just be very transparent about it. Even if you don't have it on your slides, say, this is important. You have to know this. And so it'll make them perk up and, write it down or whatever they need to do if it's not on your slides. So, does that help?
Yeah.
Yeah, it does. Thanks.
Yeah. So I know I've heard my wife, and I think it's a very good point. She lectures a lot to the PA students. And can you imagine lecturing, we're pharmacists and we're lecturing to a different discipline. Pharmacology and all this is overwhelming to us, but you get it out of our discipline and you think about, I just gave 4 hours of antibiotics to the PA students, and that's what they get for antibiotics, 4 hours. So I went through every single antibiotic in every class and stuff in 4 hours. And so I could just tell it after I did that they are just glazed over. And so what I told them is, what I think I'll do is, and I've got to do this tonight actually, is to develop a summary of the important points. But as I went through the lecture, I tried to say, this is the important point, with this particular antibiotic that you need to know about. There's a lot of other stuff there, but these are the important points that as a clinician you need to know about. And I think not that I'm good at this, but I think a good lecture, after you do this more and more, I think you find ways to make sure that your students realize these are the important points you need to get out of this. There's a lot of fluff, there's a lot of other stuff in here, detail, but these are the salient, most important points. And you know where that goes back to, honestly? It goes back to your learning objectives. And that's why you need really good learning objectives that Richard will tell you, is that if you have good learning objectives, these are the salient points that you should be getting out of this lecture. And this is what you'll be tested on. He says start with the end in mind. Write the test questions first, and then write the objectives and stuff from there. But it's true, it really is. If you really have a good learning objective, then you should be able to, they should know what you're going to test them on. They should be really
Something else a professor in my school did was he had a light and bolt symbol on every slide he thought was important.
Right.
And then we all knew that was his style. So as we're going to read our study, if we saw a lightning bolt, it's like, okay, you have to know this slide for sure. Because on the exam, those are most of the questions he's going to ask you. But at least we had that symbol to cue us, okay, fine, this is important. Because even if you mention it in class, we might forget that, okay, fine, this is an important topic to discuss or to read. But having that little symbol there made a difference for us. And sometimes it was detrimental because if it was not a symbol, they were like, well, you didn't put a symbol, we didn't pay attention to it. He's like, it's still fair game. But just having that little lightning bolt really triggered our information. I know this. And it was pharmacology, so it was a lot of information. So just having that was helpful.
Good point.
So one other thing I wanted to do was to just kind of look over real quick the one-page handout that was linked for you was the 4 ways to spot a great teacher, and it kind of relates into lecturing. So to kind of highlight these 4, the first one they bring up is that the trait is that they should be intelligent, well-read, and curious. So basically saying you're willing to constantly learn. So we have that wanting to read, learn new things, that we never kind of know everything. We're also in that learning process as well. And so kind of going along with that in lecturing is that you never know what you're going to be asked to lecture on. It's not always the most interesting topics or the thing we're most passionate about. We get assigned sometimes random topics that we have to be able to teach ourselves. And Charlie, do you mind sharing kind of your experience with the surgical prophylaxis lecture? We were talking about this earlier today. I think it's a good example of this.
When we had our search, first of all, going to the lecture, like, why are we even learning about this? And then, I paid attention, but it wasn't something that I was really excited about. I thought it wasn't important at that point. Didn't have a lot of inpatient experience, but now staffing at the VA, we get a lot of pre-op antibiotic cisplatin. So that's something I'm going to mention in my lecture that I never thought I was going to see it again, but I'm giving a lecture on it now, and it's really important.
Cefazoline's the answer, basically. It is the answer. And if they're allergic, vancomycin.
Right. But no, I'm just going to point that out. And that's like the one lecture I did not see.
But I think one of the points too, Shiley, that's very important with that particular lecture, surgical prophylaxis. I think if you could teach them concepts, what's on the skin, what are the organisms on the skin and stuff, rather than, and I think this is so true with all that you do, rather than have the students try to memorize facts that, again, in pharmacy, we do need to memorize the facts, that's a given. Yeah. But if you can tie it in, a good lecturer or a good instructor will give you anchors, will give you hooks, and, you may be memorizing something, but you're giving them a hook to put it with, okay? On the skin, strep, and staph. That's why we need to use a first-generation cephalosporin generated for surgical prophylaxis. You give them kind of that hook to keep it with, or some kind of a mnemonic or something that kind of is a good anchor for them to kind of help them to understand that.
Yeah,
So.
And I know my lecture, and the reason why I didn't say this because it was so in-depth and detailed, so overwhelming. So I think that was something that you reminded me about, focusing on, okay, the surgical site, what organisms are normally there, then
Yes.
classify them as you're positive, you're negative, anaerobic, so on and so forth. And then trying to pick your antibiotic based on that, and just bigger concepts and not getting bogged down on the details, because in all honesty, is a patient or a pharmacist that works in the community going to see like that type of, you know, area of pharmacy? Probably not, but it's like I said, I see it now. I did not expect to at all. So.
Yeah, and why I wanted Charlotte to kind of bring up that example, and hopefully everyone could hear that kind of in a nutshell, is that she wasn't her favorite lecture in pharmacy school, but now she actually sees it during her residency on a regular basis, and now she's lecturing on surgical prophylaxis. So those things that we always say, oh, I'm never going to use that information, or I'm never going to practice in that area of pharmacy, and then what do you know, you end up using that information on a daily basis. So just always like never ruling out any topic, never saying never with anything, just being willing to kind of take on anything. And that's a big thing with lecturing, or definitely faculty, for anyone thinking about an academic future, is that you have to be willing to kind of make yourself an expert in any given topic. You never know, based on the school you're at, where those gaps are, what you're going to be asked to do. So just having really good study skills and research skills to be able to go in and delve into a topic and really try to make sense of it and be able to reiterate that back in an organized fashion. So you always have to be willing to take on those topics that were out in left field for you, or not your favorite thing, become your new focus, your new specialty.
And there's a lot of reading. Sometimes I find that if I have to give a topic that I'm not that familiar with, I have to understand it myself first very well before then I can even begin to articulate it to somebody else. So there's so much reading that goes into the background of that, even before you even develop a slide or something like that. So just to familiarize yourself. But I think, you know, we've all had, you know, I think when you understand it, understanding, I think, is a given. You have to understand it, and then it becomes the delivery and stuff and actually how you do it. But I think you have to start with understanding the material first, which is probably what you kind of had to do.
It's different. But I realized that like lectures, it's a lot different than giving like a case presentation or like talking about diabetes. Like I didn't realize that until actually going through it. So that would be something I would really want to recognize before going into lecture. Okay, like here, there's like the, I guess like the form of the lecture, I guess, in terms of, it was like, I don't know how to really describe it, but like I wasn't going over like, I guess like different treatments and like how normal, like how I remembered like my therapeutic lectures for say like hypertension or diabetes or certain, you know, or infectious disease topics. That was different for me, and I think I would recognize like how formal lectures before actually going into it. That makes sense.
Yeah, definitely. So going back to our kind of 4 great characteristics here. So 1, we're curious, we're constantly wanting to learn, willing to take on any topic. The next thing they bring in is about having high expectations for students. So not thinking that based on the one impression you get of a student, oh, they're a good student, they're a poor student, that they're constantly able to learn, and you're constantly setting that bar higher and wanting them to achieve that. Not just bring it down that, oh, they're not willing to do the work, I'm going to change what I'm expecting of them, but really trying to motivate them to reach the expectation level that you want them to. Third characteristic is that they're data-driven, meaning that they do lots of pre- and post-tests, so they're assessing the students very frequently to make sure that they're getting the knowledge that they need to. And it's not just, oh, I think they're getting it, I see a lot of head shaking in my class, they're nodding, they're getting it, but you actually have some type of concrete objective measure that shows that they were able to understand that material and able to put it back into a realistic setting or questions or cases that you're assessing and grading for them. And then the last thing was asking great questions. So trying to move from not just factual information, but more into that critical thinking piece, and not just what would you treat with, but then why? Asking kind of those follow-up questions to delve a little bit deeper. Yeah, so I thought that was interesting. It kind of takes a different spin on lecturing and teaching, but gives you some 4 really great things to be thinking about as you're developing lectures and practicing and kind of moving forward. So what other questions can we answer about developing presentations and getting ready for these lectures? covered everything.
I have a comment. So I've been out of school now for longer than I'd like to admit. But I was just asking someone who had just given a lecture, and I find out that everything is electronic and people are taking notes electronically, which is all very different than how I went to school. And so I want to make sure that I am going to be delivering in a format that they can learn from, and I'm delivering, you know, if I'm going in there and I'm going to hand out the paper slides like they used to when I was there, you know, how I want to make sure that the students can learn and take notes, because you're saying, oh, you know, just give bullet points, but how do I fill in, or how can I make that the most fluid for them to give and take?
Mm-hmm. I would definitely, wherever that you are set up to be lecturing, ideally you would have a contact person there, maybe the person whose course you're teaching in, that you can speak with them about how they commonly post their lectures, or what is the most common way that they're presenting to the students, to see if there is like a set thing. So here at Shenandoah, we typically do PowerPoint presentations that are posted to the students ahead of lecture, so they have them up during the course of the lecture. They pull them up themselves. So kind of knowing what the norm is, and maybe if they can send you an example, maybe a completely unrelated topic, but here's a standard lecture, what it typically would look like. So you kind of have something to go off of depending on whatever format they use, just so you know that you're being consistent with the other lectures of that site.
So I don't want to interrupt, but I'm afraid that we're going to get cut off here any second. So it might be a good time to conclude.
Okay. But for the question that we just had, does that help, or did you have any follow-up questions to that one?
I think I'll follow up with Mark.
Is that Carolyn?
Yeah.
Yeah. Yeah, we'll follow up with that. I think the other thing is to come in and observe class too.
That would be really helpful.
Where you actually give the lecture.
Definitely.
So, yep. So know your audience exactly. You're that's exactly what you need to do. So, all right.
Yeah, thank you everyone for your great feedback and participation tonight. So email us with any questions that you have coming up, but have a great night.
All right, guys.